Hello, good morning or good afternoon to you, depending on where you are in the country. My name is Kent Mitchell. I am the Director of State Affairs with the National Head Start Association. And it's my honor to welcome you here today to our second in a three-part state policy webinar series that we are doing in partnership with the National Community Action Partnership, Think Babies and 0 to 3. So wonderful to have those partners help National Head Start Association with this webinar series, which is really focused on how to advance opportunities and access to Head Start and early Head Start in the states for young children and families, particularly those from at-risk backgrounds. Today I'm excited because we're going to be focusing on how state partnerships and state policy can build resilient systems for these children and families. So really digging into some of the policy options, but also kind of the ways state operates and how those can support alignment, collaboration, and access to Head Start and early Head Start. Got a great panelist group for you today, and so let's go ahead and dig in. So our first three goals today, our learning goals for today are to dig into how state funding of Head Start strengthens state early childhood systems. So a number of states do provide direct funding to Head Start, and we want to focus in on those states and understand how that is supportive. The second is to talk about and learn about the importance and the many types of state partnerships and collaborations with Head Start. There's literally almost endless ways to collaborate with Head Start. We're going to talk today about school partnerships. We're going to talk about childcare partnerships, partnerships to support really vulnerable and at-risk populations, all sorts of things we're going to cover today. And then the third, which I keyed off to mention a little bit as we started here, is the role of leadership and relationships in supporting local, state, and federal support and alignment work. So critical. At the end of the day, we're all human beings, and it's about how we lead together and relate to one another, which is so critical in the field of early childhood, and is so critical for Head Start and early Head Start, which is all about relationships with families, with communities, and with systems as well. Now we're going to get things started, getting you a little bit engaged by using the chat function. You should see the chat or question function in there that you should be able to use. And because we wanted to focus today on the concept of resilient systems and understanding that we believe Head Start and early Head Start makes state systems more resilient and more strong, you know, that's kind of a big and broad term. So we wanted to turn to you, and I'd ask you to look at that term and think about, reflect on that for the next 30 to 60 seconds here, and then put in the chat for us, what does your answer to what does a resilient early childhood system look like? You know, what traits does a resilient system hold, and how is it better able to serve children and families? Because ultimately, at the end of the day, that's the key to all of this, is how do we improve services to kids and families? So go ahead, take a moment to reflect on that, and I will be monitoring the chat and sharing some of the responses that we get. And I'll be reading them off a little bit in real time. Sheila says, it has to be able to adjust as needed. Absolutely, adaptation is certainly the sign of a resilient system. Another comment, enough flexible funding, stable funding, flexible and nimble, doesn't fold in a crisis. Absolutely, and we are in a crisis right now. Strong and healthy relationships, that's what families get. Flexibility for families, they all have different kinds of needs. We know they need flexibility. It reduces barriers, wonderful. It's based on parent needs, perfect. All children and family have access. Access is huge. A well-supported workforce. The system has partners to support it, perfect. Strong local partnerships. Can hear parent voices, able to rise to challenges. Educates all children, what a great vision there. Nita says intentional collaboration between state stakeholders. It listens to communities. Connie, it promotes mental health. Keep them coming. Let's get a couple more in there. This is awesome. Able to rise to challenges, adapt to needs. Perfect. I think you see a lot of the real key needs here, and we'll try to take stock of those and keep track of those. A lot of the things we're proud Head Start does is listen to families, engage families, be adaptive, And that's what we want for all of our systems and sectors. And we know that those are embodied in many state systems and sectors as well. I see another point on cost savings through collaboration, supportive partners. Perfect. Awesome. Well, thank you all so much for kicking things off, a little participation there. So let's go into the rest of our presentation. So before we dig a little further into those topics, though, I just wanted to share a little bit about the National Head Start Association. So we are a member-driven association, and our mission is to coalesce, inspire, and support the Head Start field as a leader in early childhood development and education. We really are the Head Start community. We're the voice for the 1 million children, 1,600 programs, and 270,000 staff of Head Start, a wonderful community. And very specific and important for this call is we partner with 50 state Head Start associations, collaboration directors in all states, and many, many other stakeholders. So I want to always mention those partnerships and those really important memberships. Before I get started here and we really dig into our second webinar, this is part of a series. So on July 28th, we had our first in this series on state policy, and we really focused on COVID-19 and how Head Start and Early Head Start have responded to the need in states. We heard from the Mid-Willamette Valley Community Action Agency, and you can see some of how they are adapting their programming to accommodate social distancing. It definitely warms my heart, right? This is an agency that never closed, that served essential workers and has continued to operate like all of Head Start, which has continued to operate throughout this pandemic, changing their model, innovating, and serving kids and families in new ways. We also heard from the brand new New Mexico Early Childhood Education and Care Department, who was recently created by the governor and the legislature there, and they have dedicated funding to focus on the early years. So we heard from leaders there about their vision for that new agency, how it brings under this umbrella Head Start collaboration and Head Start partnerships and childcare partnerships, pre-K, home visiting. So really got a good view of how cabinet agencies and administrations can highlight and work with Head Start and other early childhood programs. And then we also heard from 0 to 3, one of our key partners, about their State of Babies Yearbook 2020. And I just excerpted a point here. They really broke down some of the access gaps for early Head Start in particular, as well as some of the policies that states can enact around ratios, group sizes, and funding that really support access to high quality infant and toddler care. They also focused in on racial disparities and income disparities as well. So really gave us a really nice picture of some of the challenges that we still need to address in our systems. So let's get right to it. We have a great panel today. And I'm really excited because today we have 3 great state and local leaders from Pennsylvania, Oklahoma, and Texas, really representing a great swath of our country and able to share their views on how Head Start and Early Head Start can look in states and what that can look like. So I'm going to do a little introductions first and then turn the stage over to them for some of their key points. So Karen Grimm-Thomas is the Director of External Relations at the Pennsylvania Office of Child Development and Early Learning. She earned her BS in Human Development and Family Studies from Penn State, followed by a master's degree from the University of Illinois at Champaign-Urbana. She spent the majority of her career working in Head Start, where she held a number of roles, including classroom mentor, education coordinator, and training coordinator. Prior to coming to OC Dell, she spent 12 years as the Associate Director of the Pennsylvania Head Start Association, where she represented the Head Start community on many committees. In her current role, Karen coordinates OCDEL's stakeholder engagement in order to promote a deeper understanding of policy in the field and provide feedback on how policy is being experienced in the day-to-day work of OCDEL stakeholders. So I think that's a great example, building on what we heard in the chat about a system that listens to stakeholders and responds to it. So Karen, thank you for being here today. Christina Ellis is the Director of Health and Collaborative Services with CAP Tulsa. They are a nonprofit community services agency. Her background includes nonprofit management of functions including early childhood development, food service, health, nutrition, risk management, and quality improvement. She began her education career at the YMCA as a camp counselor, and she holds a BA from the University of Central Oklahoma and an MPA from the University of Oklahoma. And she has served on the governing boards of several social service associations. Her particular interest in policy stems from her rich background in social services work and her commitment to early childhood education and family engagement. Christina, thank you for being here today. And finally, Dr. Alferma Giles is the director of the Texas Head Start State Collaboration Office at the University of Texas Health Science Center. She provides in that role leadership management and oversight of the initiatives of the Office of Head Start and the priorities of the state's Head Start Collaboration Office. Dr. Giles has been in the early childhood field for over 37 years, working in various capacities as a pre-K and kindergarten teacher, education coordinator, Head Start specialist, HR coordinator, and other roles. A native of Arkansas, she's been employed with the Monterey County Office of Education in Salinas, while held various roles in the Oakland community, and currently serves on many boards and committees, including being appointed by Texas Governor Greg Abbott to serve on the Texas Early Learning Council in January of last year. She received her bachelor's degree in child development from the University of Arkansas at Pine Bluff, and her master's and doctorate degrees in education administration from Madison University. So thank you all for being here. So great to have such a great panel today. So we are going to start with me just relaying some of the key takeaways, 3 key takeaways, one from each of our panelists. And we're going to turn right to them to dig deeper into these. So at a very high level, right, 3 things we really want you to take away from today. So this is the moment where we're going to share those and really dig into those in the next 20 minutes or so. The first from Karen is how important state funding for Head Start is and how it can come from multiple sources in a state. So you'll hear a great story from Pennsylvania about how they've integrated through state funding Head Start into their ecosystem. From Christina, the importance of layering and alignment of state and private resources is key, and how it allows for alignment around also quality standards. So a great story from Oklahoma about private philanthropy and childcare and how the state has stepped up as well. And then finally from Alferma, continuing a key theme we want to really lean into today is about relationships at both the state and the local level, and how that allows for building towards school readiness for all children, regardless of the program that they are in. So with that, I want to turn it right over to Karen. Karen, why don't you share about the story of Pennsylvania's investment in Head Start, the diversity of that, and some of the impacts you think it has on building the resilient systems we all want to see.
Great. Can you hear me? Can everyone hear me?
We're having a little bit of challenge with the audio. Do you want to try again?
Can you hear me now?
That's perfect. Yeah.
Okay, great. I'm hearing an echo though, so it's going to make it a little hard for me because I hear everything I'm saying just a second or so back. Okay, so hi, my name is Karen Graham-Thomas, and I'm the Director of External Relations for the Office of Child Development and Early Learning here in Pennsylvania. I'm very happy to be included in on this webinar. As Kent mentioned, I spent the majority of my career, my professional career, working in Head Start programs here in Pennsylvania. So it's near and dear to my heart, and I'm not unlike a lot of folks within our Office of Child Development and Early Learning, what we refer to as OCDEL. And we have a lot of former Head Start folks in our office these days. And I think that's, again, as we talk about relationships, going to be part of the strength of that. So Pennsylvania, OCDEL is a unique department in state government in that we are actually located within 2 different departments in state government. We are jointly located between the Department of Human Services and the Department of Education. So depending on the programming that we're overseeing, that we're talking about in the funding stream, it was a way to pool together all of that information, all that funding for children ages birth to, up through our school age folks, our school age childcare folks, into one place to really ensure that the likelihood that the left hand knew what the right hand was doing was really something that we're pretty proud of. Octal has been in existence for probably about 13 years, and right about the time that the Octal was developed, Pennsylvania started to take a look at its early childhood programs and what kind of state investment it could be putting into early childhood. And Head Start was one of the very first programs that Pennsylvania chose to put state money into. So we have a system right now, we call it our State Supplemental Assistance Program, and basically our federal Head Start grantees are eligible, and it takes state dollars and just adds additional slots onto their federal model. So we recognize them as high quality, minimal kinds of reporting and monitoring. We really kind of look to the Office of Head Start and the federal system to do that monitoring. So this was really how we started to think about state investments in early childhood beyond what was happening in childcare through the Child Care Development Fund. We then were able to transition as time went on and add a state funded pre-K program with an educational component, the classroom component that's really modeled a lot after the Head Start performance standards as it relates to the classroom. So, and we are very proud of the fact that we refer to ourselves as a mixed delivery state as well. So we have a number of different entities then that are eligible to provide pre-K services, including childcare programs that meet high quality standards in our state QRIS, our school districts, and our state, private nursery school programs, and then our federal Head Start grantees are eligible to provide those services. And the way programs are then able to kind of layer things together and really look at their program in terms of targeting needs of families. I think it's just another, it's another tool that they have to be able to do that. As time moved on, we were then able to do other kinds of things, early Head Start, child care partnerships, and early Head Start. Pennsylvania was the first state to become an early Head Start grantee, and we've then expanded into early Head Start child care partnerships. And I think really have seen the benefits of that program in terms of growing high quality programming for infants and toddlers, to the point where we've actually in the last couple of years been implementing a smaller scale program for licensed childcare where we look at a slots model for how we distribute Child Care Development Fund dollars to them. So rather than paying based on attendance, we're paying based on slots, things that we learned within the early Head Start Child Care model, our Child Care Partnerships model, to try to stabilize those programs. And then last but definitely not least, Pennsylvania is a McV state, and early Head Start from the beginning was one of the models that we recognized as being eligible to apply for those McV funds. That federal funding then, because of the success that we saw and some great partnerships with advocacy organizations in the state, we were able to then expand on that, and we now actually use state dollars, and it's very similar to what we do with our state supplemental assistance program for Head Start, in that we take our McV grantees and provide them with additional dollars to add slots, state dollars to add additional slots onto the model that they're already operating. So our early Head Start home visiting folks can take advantage of that as well. So that's kind of the layout of all of our programs, and I think you can see that we started with that kind of replicating and providing Head Start grantees, whether it was Head Start center-based programs or early Head Start home visiting, with those dollars to just kind of match what they're doing. And then that has kind of trickled into other ways to think about expanding and using the same kinds of Head Start as a quality base to really kind of take a look at what does our pre-K program look like, and move beyond that. I think you had one more slide, Kent, for me.
Yeah, it would be great. Yeah, if you want to address some of how your governor has carried the mantle. Obviously, you've been doing this for many years in your state, but in this time, right, how is Governor Wolf looking at these investments in early learning, and how does Head Start factor into his own thinking or his administration's?
Yeah, we've in Pennsylvania been very fortunate to have a series of governors that have really really understood the importance of early learning and the foundation that it lays. We've also had really great advocacy that's happened. We've had a coalition of different advocacy organizations that came from different sectors within the state that kind of came together to really advocate around these high quality experiences for young kids, and ensuring that they're getting a segment of funding. So Governor Wolf has continued that. He throughout his first administration and now into his second administration, we've seen continued investments in our pre-K programs, in our Head Start supplemental program. It was under the Governor Wolf's administration that we actually saw the expansion of our home, state funds for our home visiting programs. So he's continued to recognize that the role that early learning plays, but I think also the idea that Head Start really is, when you're looking at high quality programming for kiddos, and particularly our kiddos, most vulnerable ones that are below the poverty level, those comprehensive services that they're able to provide are really key. And so it's a really integral part of this ongoing system.
Excellent. Well, before we move on to Christina, we did have one question in the chat I wanted to share, which is, obviously, so you've shared that the state is an Early Head Start Child Care Partnership grantee. The question was, are there other Early Head Start Child Care Partnership grantees in the state? And how does that, if so, how does that state-local dynamic work in that case?
Yeah, we have a robust Early Head Start Child Care Partnerships, grantees within our state. So as a state, Pennsylvania, we have kind of a hub model where we have, we really make it an effort when new funding comes out to do, requests for intent letters and really kind of look at where are those other Early Head Start Child Care Partnerships grantees, or even just Early Head Start grantees, to make sure that we're not going into areas that they serve and to create any kind of undue competition. So it's really about taking those childcare programs and trying to provide that, those additional supports to really increase that overall quality and help them provide comprehensive services that so many of our kids that are in the childcare works, that's what we call our subsidized childcare system, childcare works, that really could benefit from those comprehensive services because their families might be working full time and in need of full-time care, but they still qualify for Head Start services. So it's a lot of very much kind of, getting those requests in, seeing who wants. It's a whole other like added layer to the application process to really kind of ensure that we are not trying to expand into areas that might impact another grantee.
That's great. And I'll just end with one final question from myself too. So obviously in that respect, right, I can see you, right, looking through data and understanding where the needs are, but we're going to hit on this theme of relationships a lot. So anything you want to share about how this clearly is working in your state? So how do you invest in relationships and that through your model, and share a little bit about that because we know how important that is for these alignment efforts to work.
Yeah, we have a lot of things, I think, that really kind of our systems are set up after years of really working through this, starting with Ocdel as that kind of dual deputate. We also are really fortunate that our Head Start Collaboration Office Director is situated in one of our direct business partners, so we have that really close access there. Again, I mentioned we've got just a lot of folks that are within our office that came from a Head Start background and have real deep roots in the Head Start community throughout the state. And I think just this administration, particularly the Wolf administration, is very committed to stakeholder engagement and that stakeholder feedback. And so just the existence of my position, I don't often find other folks in state government in other states where my main job is to sit and listen to stakeholders, and not just listen to them, but actually I'm embedded in our leadership team, in our executive team. And one of my big roles is to bring that information back, to bring what I'm hearing back to that leadership team. We're also really fortunate in that in the last couple of years, we've restructured, really looked at when CCDBG was reauthorized and took the kind of shift from just access to childcare to access to high quality childcare to heart. And so we have divided our state into 19 regions, and we have what we call early learning resource centers, which we look at as kind of Octal hubs in different communities. And we've pulled together, you know, the funding for access to childcare, along with the funding for quality in our QRIS system, into those organizations at the local level. And so it really is about setting up these leaders at the local level to have that, you know, they really understand the nuances of their communities. They understand who the leaders are in the different places. And we're really working to, you know, kind of take those silos and just kind of break them down and integrate everybody together as much as we can. And those ELRCs really create those tables for us. They have that kind of table where there's a seat for everybody. Hello? Okay, I'm not sure if I've lost you all. Are there others on the call that can hear me? Is it just me that can't hear?
Hey, Karen, I can hear you. This is Katrina from 0 to 3. I think we may have lost our
Kent. Did we lose
fearless navigator here. Let me grab a hold of the slide. I don't know if he gave me the power to do that or not.
Karen, this is Al Farm. I can hear you too. I can hear both you and both you all, but I can't hear Ken anymore.
Yeah, I'm not able to move the slides ahead either.
Oh.
This is Christina Ellis. Should I move forward with my remarks?
Please do so, Christina.
Okay, fantastic. So similar to Pennsylvania, Oklahoma has a long history in the early childhood community for support and advocacy. We started pre-K for all children in 1998. And my remarks today, though, are going to be centered on a statewide early childhood program. As mentioned earlier in the key takeaway for my discussion is layered funding is key to expanding and strengthening Head Start and Early Head Start in states. Specifically, I'll be talking about the Oklahoma Early Childhood Program. This program provides the fiscal structure that aligns state and private resources to promote high-quality standards tied to minimum teacher qualifications, ongoing professional development, parent supports designed to foster low-income families' independence and economic success. And if that sounds familiar, it's because this program, a lot of the program requirements were guided by Head Start performance standards. And so funding for this program flows through the Oklahoma State Department of Education as a match to private funds provided by philanthropists and corporations throughout the state. This program was founded in 2006 with $5 million from the state and $10 million in a private match. And whenever the slides come back up, you'll be able to see more information about funding there, as well as some information about details of the program as far as children and families served, the type of providers that we have. That includes child care centers, Head Start, Early Head Start, Educares, and tribe, as well as the tribal community. One of the things that I want to mention is where we are now with the funding. So we started with $5 million in state and $10 million in private, and in 2020 now, it's exciting to see an increase in that we have, of course, I lost my notes there on the paper, $12 million in state for 2020, and that increase was to match the public school teacher raises, which is a program requirement. So currently in Oklahoma, 74% of all 4-year-olds are enrolled in public pre-K, with 99.4% of districts offering either a full or half-day program. And one of the things that I've been hearing a lot in the Head Start world is how we see this number continue to rise and how we have to rethink our community footprint as more children are enrolling in public school pre-K. And one of the things with layered funding that we've had recently come to our state as a result of the EHS CCP awards in the state of Oklahoma, DHS subsidy policy was expanded to allow those slots to layer state subsidy with federal funds. So some of you might already have that in your state, but prior to that time, in Oklahoma, subsidy funding cannot be used for program time funded with federal dollars. So in 2018, through an emergency rule by the incoming governor and funded through the block grant, the new subsidy policy was further extended to the Oklahoma early childhood programs, including the EHS agencies. So previously with the Oklahoma early childhood program, we layered private and state funds. And then through the rule that was changed with the introduction of the EHS CCP awards, now we can also layer in state funding. And our next step, it's one of those things that it never stops. So we have to keep moving and changing with the times. And so we've submitted an additional recommendation to the State Department of Human Services to include EHS and Head Start to this exemption. Because again, currently, if you're an early Head Start or a Head Start program, you cannot layer on child care subsidy to that. So right now, it's currently in the review process, and we hope to get that approved to benefit not only the Oklahoma early childhood programs, but all child care programs across the state. So those are my beginning remarks, Kent. I didn't know if you had any follow-up questions.
Hi, I don't think that Kent has rejoined us yet. And I don't see any questions that have come in the question box, but folks can certainly submit those. We are working on getting that PowerPoint back right now if we can. We've completely lost Kent, it seems like. So thank you so much for sharing that. And if questions come in, I will bring those up. Oh, there we go. Looks like we have a PowerPoint again, at least. Thank you, Erin. So I'll wait for you to get caught up to us there.
I think we're now at Texas, it seems, so we can, I guess, carry on at this point. Yep. Thank you, Kent. I don't know if you can hear me or not, and thank you all for joining us today. Texas is not a state that receives state funds for Head Start, so I'm going to speak from a partnership perspective, so to speak. And the slide that you're able to see, the portion that you're able to see, includes some of the local and state agency partners and committees and work groups that I engage with on ongoing. And it's quite extensive. It's probably about 33 of them, if I can recall. I tried to make it cute and presentable, but I just listed them and said, okay, we'll just go for it. So anyways, as you all know, with anything, building relationships, it can be very difficult, and certainly at the state level, more or less. And in the state of Texas, being that we're so large, it can be very challenging. It has been quite a challenge, but we've been able to work through our largeness in our state and to be a little more cohesive in our work relationships. And I think a lot of that came about through the pre-K development grant. We were initially awarded the grant, and with that, we were able to reestablish the Texas Early Learning Council, which are governor-appointed positions on the council. So Governor Abbott appointed 20 members of the Texas Early Learning Council in January of 2019. And with that, it included key individuals from state agencies. So this was really a segue for us to use to work more cohesively together. And it's not that we weren't having state agency meetings, because we were, but this brought everyone to the table, and then some additional people who really weren't at the table. So it helped us in our ability to reach everyone. I would say, to ensure that we were able to build on our working relationships across the board. And so with the establishment of the council, we were able to use the pre-K development funds to develop the Texas Early Learning State Plan, which is the strategic plan that we are now beginning to implement. It was recently published, and we have started the work of the state plan, beginning with goal 5. So we have 6 goals that we're working on, and we're beginning our work with goal 5, which it's very, again, difficult to dig into, because it's talking about building systems, and systems building in a lot of states are very difficult because no one wants to let go of what they are already doing. And with us, we have decided that we would work in whatever capacity that we could work to ensure that our systems would work together. And also, some of us would have to not use what we're used to, but then engage in the use of other systems. So the goal that we're now working on is planning for a well-organized system of early childhood services, and that it means across the board from in every area of the early childhood spectrum. And so one blessing for me is that my office is located at the Children's Learning Institute at the University of Texas Health Science Center in Houston, which is the state center for early childhood education. And they had a long-standing relationship with the Texas Education Agency, which is our state education agency. And with that research and development, testing and implementation from the Children's Learning Institute, it involved a lot of the other state agencies that I now work with. So everything that was developed and implemented at the university included Head Start and Early Head Start. A lot of the Early Head Start and Head Start programs were used as demonstration classrooms, and they were used to test different things. So I was really pleased with that. And as you can see, I know this slide keep going out from all of these state agencies. This is the work that we do. And then with Texas being so large, the counties that we serve, we have a huge state with, as you can see on this slide, is 254 counties, and we have like 219 programs in those counties, and 25 of those are partnership counties. And so only the 35 counties in our state that does not serve Head Start program, those are the ones that are in gray. So those I would consider maybe also childcare deserts. Not a large number of childcares may be located in those areas. Some of them are very remote, and we have a challenge in reaching those communities. But I think that we are on board now in our systems building where we are able to reach the remote communities. The good thing is there's early childhood intervention in each one of the counties. So the children with disabilities are receiving services, but those areas where there are not any Head Start or early Head Start programs close, of course, then they are sometimes at a loss, or they are not receiving the services that they should. So my big key here is that regardless to what level of representation you have at the table, you make sure that you have key people who can help you build systems, and who, regardless to the program option, that you're working toward the common goal of making sure that children are ready for school. We actively plan together. We participate in a lot of meetings and engaging in working activities. So this is our approach to building effective Head Start, early Head Start, childcare, and school district partnerships. And Kent had asked that I mentioned one of our key things that we've worked on in our state, which is the Office of Head Start initiative for transition to kindergarten. And it was a successful Office of Head Start public school collaboration demonstration project that Dr. Bergeron, our director, started last June. A group of us met, it was about 13 groups met in Scottsdale, Arizona for this demonstration project. And I tell you, it was something to reckon with. We took our time to explore and examine the needs from Head Start and from the school district side to determine how we could work better together. And Dr. Bergeron's vision was that schools and Head Start would have a seamless transition from Head Start to the public school system. And sometimes that's not easy, especially if you don't have the again, key people on board. And serving our most at-risk children, this was very important. So it was very successful in the fact that there were superintendents and principals, agency directors, school administrators, disabilities managers, McV staff, from the district. We had the district representation and we had the Head Start. And one thing for certain, for those of you who are working on building partnerships, you make sure that you include state superintendents. It was very eye-opening for me to hear their voices and to hear them say that they really didn't understand Head Start until they started doing this project. And we have successfully engaged 2 of our Head Start programs, Region 19 Education Service Center Head Start, and the Canutillo School District from El Paso. And then we also had BCFS Head Start, New Braunfels, and their school district. They have they were part of this demonstration project, and they have built a successful transition to school partnership with their local schools based on the Office of Head Start model. And so I am now at this time looking at what they have done and the way that they have worked together. It was such a beautiful thing to see at the end of this project, which we kind of did at the end of the demonstration review in June or July, to talk about the successes and lessons learned and how to move forward and to keep the work going and moving forward. So it was a lot of involvement. They developed and shared, as you can see, goals. They gathered ideas from both sides. They respected each other's voices and what they brought to the table. They talked about how they could collaborate and align systems, and including registration. And so they also developed online resources and training resources to support their staff and their parents. So I am pleased to say that it was very successful, and I am going to take it a step further. I am going to now work on the state level. Dr. Bergeron said in a meeting last week that she would like to see all districts and all Head Starts doing this model. So I am going to approach our work group with this desire to, and see how we can do it, even if it's building and working with one school at a time.
Yes.
I'm also working on a transition to kindergarten model that we weren't able to implement face-to-face due to COVID, but the work continues. And Kent
Great.
will share with you the
Yeah.
Early Childhood Learning Knowledge Center website information, so you can see what it is, and it's there available to you, and anyone can use it. You can review those resources.
All right. Well, thank you, Alfarma. Can you hear me okay? Want to make sure folks can hear me.
Yeah, I can hear you, Kent.
Perfect. I apologize for the technology issues, and thanks for bearing with us on that. Christina, I wanted to ask, did you have an opportunity to share your slides? I want to make sure folks were able to see those. Okay, I'm not sure, Christina, if you're able to unmute. Let's keep moving forward.
Yes.
One of the key
The slides weren't shared, but I think
Okay.
if it's just shared afterwards, the information was shared during my remarks.
Okay, sure. I just want to show some photos of some cute kids, of course, and in action at your program and your wonderful facilities. Give you all great credit for that. We also have some information about the diversity of the funding that I'm sure you heard about and the number of kids served. So we'll send those out afterwards. Appreciate your flexibility with that. We want to focus our last 10 minutes before questions on how Head Start helps reach underserved children and promote equity. I think as many of you know, all of you know, really, Head Start has a very strong focus on equity. You'll see a little photo here about Home at Head Start, the campaign to get more children and families experiencing homelessness enrolled in Head Start, and also our partnerships with child welfare and for foster children. I'd love to turn to each of the panelists. Karen, maybe you want to pick up on how you see that playing out in your state, and you feel free to address how that has played itself out during COVID, when we know challenges have been really prevalent as well. But how do you feel like the investments in Head Start help reach kids who need it the most?
Yeah, I think that's a critical thing. I talked about it a little bit earlier, that we all on this call, we understand that the comprehensive services that Head Start can provide, although all kids benefit from a high quality early learning program, our Head Start kids and their ability to access those comprehensive services just really takes that to another level and allows them to really take advantage of that. So having those investments in those additional slots in our federal program, because we know not all of our eligible kids are able to access it, it's just another way for us to ensure that more kids are getting that. I think the other thing that happens for us too is because we are a mixed delivery system and we have Head Start grantees that are providing our pre-K services, although they might not have the same level of funding for comprehensive services the way they would if it was in their Head Start, either state funded or federal funded Head Start program, they're able to really approach that pre-K program with as much of a comprehensive lens as possible. And so even our kiddos that are maybe above 150% of poverty, our pre-K program goes up into 300% of poverty, that those kiddos are benefiting as well. We're also really proud in Pennsylvania of the work of our collaboration office. You spoke of the Head Start's emphasis on looking at children and families experiencing homelessness. And our collaboration office director, Tracy Duarte, has really done a lot of great work in this area. She has established these great relationships with we have over 500 school districts across Pennsylvania, and every one of them needs to have a coordinator. And she's just doing great work to really ensure that those coordinators understand who their Head Start grantees are and have access, and everybody is connected. So very proud of the work that she's doing.
That's awesome. Thank you so much. Christina, how about in Oklahoma?
Well, I would say in Oklahoma, in addition to what was shared by Karen, is that what happens outside of the classroom impacts children and families. So for example, healthcare like Medicaid and public health programs, basic needs like your SNAP and your WIC, and prenatal and family support like home visiting, and making sure that there's an expansion and funding for those programs. I think that's crucial in addressing racial inequity. And then support services, as mentioned earlier, inclusion, health, family support. I also think Head Start does a great job of bringing a diverse group of families together through family events. I know on the slides there were some things there about engagement with fathers. And then also the picture we're seeing right now with leaders and things like policy council, I would say would be the way that we reach undeserved communities.
Awesome. Yeah, it's a really strong element of the model. Alferma, how about in Texas? I know in our pre-planning you had mentioned the role it plays in fatherhood and developing that, but what are your thoughts in Texas? How does it strengthen families and strengthen underserved children and families?
As we all know, we are sometimes the least of all in our communities, the families that we serve. We know that much of what we know about race and inequity is not something that we're taught, but it's something that we learn at home. We're not born with this. So I think that with Head Start, we are a voice, we are a model to serve to address racial inequity. We serve diverse communities from low socioeconomic groups and the communities with limited resources. We also have a variety of families with varied needs. And I just believe that Head Start's voice from fatherhood and family and community engagement initiatives, it can be the platform to support addressing the racial inequity, because we know fathers are sometimes missing in the family. You often see the moms, you see the single moms with the children, but the dads are kind of missing. And I really think that Head Start's fatherhood initiative will serve to support this effort and keeping them engaged. And some of our states and Head Start programs in different states have very strong fatherhood initiatives that they're implementing, and I think that's one way that we can also address this.
Okay, excellent. I want to leave time, want to give a balanced view of how this work goes, and from the pre-calls and come through a little bit here. I mean, it's a lot of work to make this Head Start, early Head Start integration piece work, and the alignment and all of that. And each of you were really clear with me about ongoing challenges, things to work on in the state. Why don't you just take 1 minute each, though, so we can leave some time for questions, to key in on some of the challenges ongoing that you see in your state. And Alferma, why don't you start first?
In Texas, many of you may not know that we really don't have a supportive structure for Head Start. The politics are often in the way of building relationships or strong systems for children. And the size of our state, as I stated before, is also a problem. So we, at the state level and our state work groups, have come together to address this. And aside from the politics, we have the Build initiative that the Build State team is working to support building systems, leadership, and serving children that are present in the moment and making sure that we don't sweep things under the rug. We are navigating our system to make sure that we build supportive communities, and that the work that we do and sharing our resources will support the children as they need it, not what we want them to have, but what programs and children need. And we recognize that all families face barriers, and there's a disconnect sometimes when there's the services that are needed and then the politics that stands in the way. So in our state, we just want to work through the political pieces of it little by little so that we can serve our most vulnerable children and families.
Thank you so much. Christina, how about in Oklahoma?
Yeah, so I'll go with funding. And one of the things I want to say is that we're fortunate in Oklahoma to have philanthropists who support EC and know how important quality early care and learning are to children. I would say that a focus on state leadership to believe that layering funding is more than an option, and really push for expansion of quality programs like the Oklahoma Early Childhood Program I mentioned earlier, and home visiting, and really taking layering of funding to the next level with state buy-in, the philanthropists we already have, and the partnerships that are already in Oklahoma. I think state leadership could be the final thing that ties that all together to increase funding for these programs.
Excellent. Karen.
I think in Pennsylvania, we have it right there, the consistency across the state. So we have a lot of systems in place for the different programs to exist within the same community. But really, it comes down to local level relationships and how folks are, how children and families are being recruited into programs, and really, we defer to parent choice, but really making sure that the different folks are working together to really kind of set out like a continuum of programming that families have a choice for, and then they can really understand the benefits and the specifics of each program and make a decision that fits their family. So in some places, we've got our early learning resource centers that are just a couple of years old, and they're really kind of, charged with, again, being that agency that sets the table for people to come to. And we've got some places where folks are really integrated and their recruitment is happening together, and they're deeply connected to their school districts, and it's all working really well. And we've got other places that we're still, working on developing those relationships.
Right, and that issue, that's itself is an issue of equity, right? Making sure that every child, vulnerable kid in your state has access to the same consistent level of quality and options that they need. So thank you all for sharing that so candidly. Again, in the pre-planning, you all have a lot to share and that you've accomplished, and you're looking to do so much more. So really honored to see that. I have opened it up for questions here, and so I'm just going to take a minute to review the question box and see if we have any. One question from Christine Johnson-Staub: have any of you successfully partnered with home-based childcare, with family childcare? If anybody wants to take that question on the panel, please go ahead and let us know. Christina, is that something you've done through the private and state investment, FCCs, family childcare?
We have not partnered with family child care recently. In the state of Oklahoma, though, through the EHSCCP grant, there have been several grantees who have partnered with the child care home community, and at different degrees of, I would say, success in that.
Okay.
But I definitely connect people to the right people if they want to send me an email with their contact information.
Definitely. Well, why don't we just ask a broader question there? How do you view, in this context of quality, and Karen, maybe I'll turn to you and Alferma next. How do you view family child care? What are you seeing in that sector? Karen, I know your agency has a really broad purview. So what are your thoughts about that community and how to make sure that those partnerships are strong as well in state systems?
Yeah, we in Pennsylvania, I think, are definitely interested in exploring how we're supporting family childcare and integrating it into our systems. We've tried to take advantage of some different things that BUILD has put out for folks or for states, and have been really tuning in to Homegrown and the great resources that they're providing. I think there's a lot of work that we recognize as a state that we could do to really kind of look at family childcare and integrate it more into our systems and think about how we can support it. I would love to see our early Head Start childcare partnerships, kind of move out into this area, and kind of take a look at, particularly our state grant, and take a look at, not only looking at them as a viable partner within those grants, but then also what can we learn from that relationship, and how do we then take it to the rest of the family child care community across the state.
Excellent. Alferma, any thoughts on that point? If not, we'll turn right to calls to action.
I would just like to add that in Texas, House Bill 3 pre-K passed an 86 legislature in 2019, and it impacted open enrollment pre-K to third grade, and certainly affected Head Start, because a lot of the pre-K slots, those families then opted to go into pre-K and left a lot of slots vacant in Head Start. So with our Head Start partnerships, those partnerships with programs allow those children to then be served from the child care perspective. Those who were doing services, whether it's wraparound, before and after care, or whatever, that brought in the child care perspective. And we also have one of the child care leaders on the Texas Early Learning Council, and this has been something that she had even mentioned. So I think this will impact our enrollment. I think it will support our enrollment. I think we need to do it more on the Head Start and early Head Start level, because we know that we have those 3-year-olds who will be rising pre-K. And we have to focus on this now, because if we don't, then it's possible that we may lose those families. And then there's a chance that those families will go somewhere else. So I think that partnership is so important. We need more funding for partnerships and allowable, I guess, options for them, because a lot of the programs are maybe not what they should be, and a lot of partnerships fall by the wayside because the childcare partners are not, I guess, up to par, so to speak. So Head Start coming in to help that is a great benefit.
Awesome. All right. Well, I know we're at the top of the hour, so let's do quick calls to action. Karen, what do you want our audience to do coming out of here? What's your call to action to them?
I think just continuing to talk about Head Start and asking questions of themselves about how is Head Start integrated into a larger early childhood system in their state, and what kind of relationships, you know, even at the local level. I think, again, where we've seen real strength across our state is when local folks got together and really kind of connected and understand one another. And so I would challenge folks to do that.
Awesome. Christina.
I would challenge folks to really look into diversifying their funds through layering your state funds, your private funds, and federal funds, working with state leaders, philanthropists, and partners in your community to really leverage the funds that are already there in your state.
Awesome. And Alferma, why don't you close us out?
I think partnerships is the way to go, especially with COVID being present with us, and we don't know when it's going away. We have to partner with our child care programs. We have to partner with our school districts. And I think seeking additional funding for Head Start child care partnerships, there were some funds options available, but not for Texas. So I think in our state, we need that. And then support additional partnering, again, with school districts to strengthen the implementation of not only the early childhood umbrella, but also transitioning and providing comprehensive services on the Head Start and the child care and district side, because if children participate in Head Start, they're going to be receiving those comprehensive services. So I think that's one thing that we need to really do work for additional funding for partnerships.
All right. Well, thank you so much. Thank you to each of our panelists for sharing. Go ahead and thank them in the chat too. If you're still on, you have a moment to do that. I really appreciate you sharing your stories from Pennsylvania, Oklahoma, and Texas, and so many other things happening across our states too. I'm going to close it out with a final call to action, and I'll try to put this in the tweet, or Robin, if you would have a moment to put it in the chat section. We are still fighting for more resources for Head Start to respond to COVID-19, including providing more mental health support to families, technology for families, cleaning supplies, staffing needs, all those things. We're also fighting alongside our child care colleagues and community for more resources from Congress for our child care community so that they can rebuild, stay strong, and continue to serve children and families. It's a team effort. If you have a moment to go ahead and tweet out your support, we'll go ahead and try to put that link in the chat, and I believe it's in there now, supportheadstart.org. With that, I want to thank you all for being part of this state policy series number 2. The third one's going to be probably at the end of this month, the date to be determined, but you'll hear from us about that. And I hope you can join that one, because that one's all about advocacy. How do we get to where Pennsylvania's gotten, Oklahoma's gotten, and other states have gotten? We get there through advocacy and through building up our strength and our vision together. So we'll learn about that on our third in this series. I hope you can join. And again, appreciate you rolling with the technology issues today. And I hope you have a great rest of your day. Thank you so much for joining us.
Thank you.
Thanks, Kent.
Thank you.